how do we get policymakers and healthcare providers to recognize the role of mental health in chronic diseases like obesity and heart disease?
So I think healthcare providers actually do recognize it because they see it, they live with it every day, but they don't necessarily, number one, know what to do about the mental health contributions to these chronic illnesses. And number two, as Mary was saying before, even if they know what to do or know where to send them, access to care is problematic. Right. So over and over again, the data is very, very clear. You integrate mental health into traditional physical health settings, and the care gets better, both for mental illness and chronic disease. So that is one way, and direct answer to the question is get more providers, who have the psychiatrist or social worker right next door to their offices.
Right, and I mean, integrated healthcare is so important since we now know that about 70% of antidepressants, for instance, are prescribed by primary care doctors, even OBGYNs. So even more reason why we need to have them all in one place.
Well, and it's a reason why I know we're going to talk about parity. Parity is so important because people need mental health coverage. If you have a mental health condition or if you have a physical health condition that has mental health implications for you, you need to be able to access the mental health care. And so for decades, we've been fighting for parity, which is equal coverage for mental health care and physical health care. But there are some policies that people are talking about right now, lawsuits that are pending that would get rid of, for example, the pre-existing condition protection. So if you have a pre-existing condition, currently you can still get insurance on the individual market. So if you had that chronic condition or you had a mental health aspect to a mental health condition with it, you can still get coverage today, but if that's gone, are you still going to be able to get coverage? We also see people talking about plans that don't have all the coverage that we currently have. So under the Affordable Care Act, we had protections against pre-existing conditions exclusions, and we have essential health benefits. That means mental health and substance use has to be part of the plan. And then it has to be covered at parity, meaning equality. So we've been looking at what it was like before these protections existed, so people don't forget, because if you don't know your history, you're destined to repeat it. So we released a report today with Georgetown University called Mental Health Parity at Risk. And when we looked back at what it was like back then, let me tell you, it was rampant discrimination. People with mental illness not being able to get coverage at all. People getting exclusionary policies, which says you can have coverage except for the thing you actually need it for. Higher premiums, 20 to 50% higher premiums, higher co-pays, I mean, you name it. Difficulty accessing prescription drugs for psychiatric care. That's where we were. And we certainly do not want to return to the days of that kind of discrimination. It's not perfect today, but it's a far cry from what we were experiencing then. And I urge people to check out the report on our website.
And let me just point out there's one fact about mental illness which makes the pre-existing condition issue all the more important. And that is that mental illness strikes young and it stays with you throughout your lifetime. Right? Most mental illnesses occur in late adolescence or early adulthood. Imagine you were diagnosed with depression at age 19. You're going to have chronic remitting depression, very, very likely, for most of your adult life. You're going to have that as an active issue that needs management. Doesn't mean you're going to be suffering the whole time. Fortunately, we have good treatments, but you're going to have it as an active issue. That's going to be a pre-existing condition. Right? So most other illnesses that afflict the young are acute illnesses that get better and then you don't have to worry about it again, right? So like diabetes, psychiatric diseases strike early, they stay with you throughout your lifetime. They're going to affect you in terms of pre-existing conditions for most, if not all of your life.